Eating disorders can stem from genetics, isolation, and loneliness. The National Eating Disorders Association has reported a 58% spike in helpline messages since the beginning of the pandemic. Cronkite News reporter Faith Abercrombie talked with people in the community about what's causing the increase.
Feeling on top of the world,
you got it,
can sometimes require a helping hand.
Good job!
31 years of therapy, basically, since I was 16.
Jennifer James knows sliding through life's obstacles doesn't have an age minimum.
It was reading food labels when I knew how to read. Some breath.
The 47-year-old Arizona mom remembers having negative thoughts about her body image at 5 years old.
You know, not looking like my adoptive family, seeing differences, and then wondering why.
Jennifer is one of 30 million people in the U.S. with an eating disorder, and that number has only increased over the pandemic.
Oftentimes, trauma may induce a stress response, and then that stress in and of itself may impact the way somebody approaches food.
Eating disorders are not formally tracked like other illnesses. While the World Health Organization and the CDC track many physical and mental issues, neither include eating disorders specifically.
A lot of eating disorders are underreported or misdiagnosed, underdiagnosed, especially if you don't fit that stereotype.
We've absolutely seen an increase not only in our call volume, but in our admissions at Rosewood.
Quarantines and social distancing can be isolating, says Rosewood Ranch psychologist Dr. Dina Cabrera, a risk factor for eating disorder behaviors.
We've seen a significant increase in mood struggles, isolation, and most certainly related to disconnection.
Next to opioid addiction, people with eating disorders have the second highest risk of death for mental illnesses, which translates to about one person every 52 minutes. And since the pandemic, people reaching out for help around suicidality and self-harm has increased from 3% to 8% each month.
Food is a way that people can control something.
Despite the social barriers, James continued to work with a support group during the pandemic.
We ate dinner together on Zoom, and we did our talks and our processing and just like clung to each other like our own kind of little family.
Good job, Aiden!
James describes an eating disorder as an ongoing journey. She teaches her daughter Scarlett that every body is beautiful, positive self-talk is important.
I love it.
And a couple of happy dances doesn't hurt either.
Talking about our bodies, that our bodies are beautiful, they are the vessels of life that carry us.
Dr. Cabrera and James say getting help starts with a first step.
The power of telling one person is huge.
And that the climb is worth it.
Scarlett and I are gonna lace up our Doc Martens and walk through life, and we're gonna handle whatever happens in this life.
In Phoenix,
I like this day, Mom.
Faith Abercrombie, Cronkite News.
The National Eating Disorders Association has an online screening tool to determine if you should seek professional help. You can contact NEDA through their helpline in the form of a text message, online chat, or phone call at 800-931-2237. If you are in crisis and need help immediately, text NEDA to 741-741.